Hello everyone, welcome to the Dentalkart YouTube channel. I am Dr. Aisha Varsi and I welcome you all to this workshop. Thank you for joining us today. We at Dentalkart aim to empower dental professionals. In order to do that, we have started this workshop series for all of you. Today's workshop topic is Mastering the Art of Dental Scaling. So we will today learn what we can do to enhance our patient experience for scaling. But before I dive into it, I know all of you have been wondering about the surprise reveal that has to be on today. What is the 6K worth up to worth rupees thing that one of you are winning? Any guesses? Come on, give me some guesses. I'll give you some hint of it. So this is one of the great inventions in technology for the dental industry. It helps you communicate better to the patient and it also gives you the access to show the patient the work you have done. Any ideas? Any guesses? Come on, doctors. Give a guess. What is that one equipment in your dental clinic that has changed the way you have looked at the dentistry and the way you explain to your patient? Go ahead. Anything in the comment section? Come on. Okay, so I'll not keep you guys waiting. Here is the big reveal. This is the intraoral camera from Waldent and this is for one of you. One of you is going to win this today, doctors. So yes, one of you is going to be the winner of this one. What is the rule to win it? Well, the rule is just two simple rules. Number one, you have to subscribe to our YouTube channel, right, to stay connected of what is there latest in dentistry, right? And second is, I will ask in the end 3 questions on the basis of the workshop that we are doing right now. On the basis of the workshop, I'll ask you 3 simple questions in the end of the workshop. You have to answer that question and first rule, subscribe to our channel and at 5 p.m. today, we will announce who is the winner of this intraoral camera. So best of luck. I'm really excited for any one of you who is going to win it. Do participate. I hope this will be a very fun experience for all of you and a learning experience for all of you. So let's dive into it now. Now, while I'm discussing mastering dental scaling, right? What are the 5 topics that we're going to cover in this today? Now, the 5 topics that we are going to cover today is, number 1 is mastering the psychology of the patient. How to become someone's dentist. What is our aim from this? How to become someone's dentist, because treating a patient is different and being someone's dentist is different. Number 2 will be oral examination and patient interaction. How do we convey? What is the aim? How do we convey to the patient what is there in the oral cavity and what treatment is required for the patient, right? Number 3 would be precautions and procedures. Aim, we want to discuss what kind of scaler should we select for a safer, easier and better resulting scaling for the patient, right? Number 4, any kind of complications, right? And any kind of management of the complication. What can be the complication that the patient can face and what can be managed on the clinical level, right? Now let's move to the 5th part. I will tell you in the 5th part what is there, how can you give world-class dentistry to your patient. How can you deliver world-class dentistry to your patients, right? So these are the 5 topics we'll be covering it under. So let's dive in it. I hope everybody has joined and I hope you all have heard everything. Do participate. Keep your pen and paper on your hands so you can write down all the important things that we are going to discuss today. Ready, doctors? Let's go. So first topic is mastering the psychology of the patient. Now we all know that we are good dentists, we are great dentists, we know how to treat, but what makes our patient trust on us? How do someone thinks that I am not just getting treated, but this doctor is a part of my life, this dentist is my dentist? That word is in itself a very warming and a very happy word for us. Yes? So how do we do that? Now, before I start this topic, I want to ask all of you. I know somewhere at our experience, we all have experienced this, that somewhere some patient had walked into our clinic for scaling and said something so funny or so weird that we go like, what? Something as small as, doctor, would my teeth come out if I get the scaling done? Oh, doctor, would I look like a certain way if my clinic is done? What is that one funny line, doctors? Come on, comment down below, tell me. I know we have all been there, right? What is that one funny line that our patient has given us away? We'll be like, what? But it's okay. We'll try to master it today, how to communicate to the patient, how to tell the patient that scaling is a must-have thing you have to get done, right? But I will give you my example first. What happened in my scenario? What was my funny experience? What was my learning experience from the patient? Now, the first time I remember, I was in third year of college. I was in my perio second year posting, and one patient walked to me. He was 16 years of age, was a tobacco chewer, and I was doing his scaling. The moment I was doing the scaling, he looked at me and said, "Doctor, do I do this scaling and look like a hero when you are done?" I looked at him and I said, "Sorry?" He said, "Yes, doctor. Would I look like a hero after my scaling is done? All this calculus is removed, all this debris is removed." Now, before answering him, I run something in my mind. What? I thought, my line, this is just a 16-year-old boy. He's very young. Whatever I say to him will make his impressions about dentist. He will understand what dentists or doctors have to tell him about his habit, right? Now, what did I heard when he said, "Would I look like a hero?" I know that patient is aesthetically concerned about the treatment he is going to get, right? So I told the patient, yes, you can look like a hero, but you have to stop this habit. You have to stop eating tobacco. He looked at me and said, "Really? Will it really happen?" I said, "Yes, you have a very beautiful smile, but all this tobacco is spoiling it. Why are you eating this? You should stop and come and visit a dentist every 6 to 8 months to maintain this beautiful smile of yours." What have I done to the patient? Nothing, but I made him listen, I made him heard, and I made him think that he was being heard. I gave him an answer he wanted to listen, right? So, doctor, what do we learn from this experience? We learn that when you listen to the patient, when you hear what they have to say, patient gives you trust. Patient keeps the trust on yourself. Now, the boy still calls me and tells me, "Doctor, where I have to come?" He has luckily quitted the habit of tobacco as well. So what experience did I get into this? I learned that explaining the patient what they have to listen, what they want to listen, changes the way they look at a procedure, they look at the treatment, right? So what did I do? Just simple thing, I listened to him first. What was his idea of getting a scaling done? What was there that he wanted from the scaling? He wanted a aesthetic correction. He was more inclined to the aesthetic part. So doctors, before taking the chief complaint, before doing anything, when the patient is walking into your dental clinic, try to interact, try to have a conversation, try to listen to the patient. Now, I know we are all very excited when the patient comes and we are very welcoming and everything, but often we lack listening. Why? Because we are very focused on the treatment and we know we'll deliver a very good treatment, but what about listening to the patient? Now, how do we exercise? How do we learn to do that? We will do an exercise. I will tell you a listening tool today, right? So there is a listening tool known as MVE. Write it down somewhere, docs. MVE, where M stands for mirroring, V stands for validating, and E stands for empathizing. Now, mirroring, validating, and empathizing is going to make us better in listening to the patient, right, in communicating to the patient. Don't think that the patient will come and get your treatment then after you listen to them. No, but they will have a trust. You can start the conversation, you know what to talk to that person, what to talk to that patient, right? So M, V and E, mirroring, validating and empathizing. Now let's use this in a term and see what the magic happens, right? Now let's imagine one of our patient walks into the clinic and says that, you know, I hate dentist. How do you charge so much for a special, you know, a small thing like scaling? Everything is done by the scaler, you know. What is your part in it? Why do dentists charge so much? Now, what do we hear from it? The patient is negative. They might have got the scaling done before and they were not satisfied from the result. Now, what do? Now, we have heard, but we have to listen. There's a difference between hearing something and listening something, doctors. So now, let's take the scenario and use mirroring, validating and empathizing. I would reply to the patient as, I heard what you said. I heard what you said. What I'm doing? Mirroring the same line. You hate dentist. Now, validate the line. Or I imagine the treatment you would have got is very bad, right? Now, empathize. But, and I understand because, you know, I would have had the same feeling as well. But, what happened? Now, what have we done? We have given the person the benefit of doubt that yes, you are right, dentists are vicious creature, you have been cheated. I know we do not agree to this line, we understand the other dentists would have done better too, but there was something that was lagged. Now when you have given the patient a same page to talk about, the patient will start opening up. Now ask the patient, yes, I understand that it would have been very horrifying for you, but what went wrong? Tell me more. Now the patient will start telling you. The patient will start conversation with you. Now, well, while they'll be telling, they'll be like, oh yeah, you know, doctor, they charged me so much. Or, you know, doctor, the outcome was not nice. Or, doctor, you know, my teeth didn't look white. Now, when the patient is saying all these words, remember, these are your don't for the treatment. These are your don't for the treatment. Now you know that the patient was not satisfied from the cost. They did not like the way their teeth look after the treatment. The gap was there because the removal of calculus, but the patient does not understood it. The patient thought that there was a gap in my teeth. Now there is what the patient was unsatisfied about. Now you understand what are the don'ts. Ask the important question. Okay, I understand. Oh, this was horrifying. But let me ask you one question, uncle, more. Mr., Mrs., ma'am, sir, that was the cost only issue? Was the gap in your teeth only issue? Was this point only issue for you? Or there was something else you want to discuss with us? Something else that you thought that the scaling was not nice? Please help me understand so we can discuss it. Now, what have you done? You have given all the power to the patient that you will tell me what to do with you. I will not do anything that you don't want. Now the patient will give a clarity to you, will give a page to you where they will tell you everything they're expecting from the treatment. Everything they're expecting from the treatment. Now you know what the patient has done. While talking all this, what did we do? We gained the patient trust. We gained the patient trust to interact with us, to talk with us, to think that this dentist can be my dentist. Reason being, you have told them that I am listening to you. It's not that what I have seen and I will do according to the books. It is what you want I will do for you. Now, all human beings want to be heard and listened. Now, so the patient will think, oh, this doctor is more declined to me rather than declined to the treatment. Now, this simple exercise of listening, MVE, has done what for us? They have made us trustworthy in the patient's eye. Doctors, practice this MVE in your life with your patients. I tell you, you will see the difference. Never answer negativity with a negativity or a neutral background. The person will never be ready to hear. If you want them to be heard, they felt to be heard, give them a common ground. Now, here I'll end this topic. I hope you guys have got the takeaway. If you have any questions, down in the comment section. We'll reply after the live is over. Right? Any more things you want to ask about this topic, do comment it down. We will try to reach you back and answer you. Right? Now from this we move on. Now the patient is ready. The patient wants to talk to you. You understand what the patient wants. Now it's your time to check the patient. We have to do the oral examination of the patient. Now while we are doing the oral examination, let's move to the second topic. Oral examination and patient interaction. Now what do I mean by oral examination and patient interaction? The aim is to make the patient understand what we are doing with the patient, right? Make the patient tell what are the findings, how do we tell the findings, how the patient understand that the treatment is important for them to get it, right? Now, let's imagine a scenario. A patient walked into my clinic. I am the patient for you, right? Let's take this as a scenario. And you are telling me that, you have, okay, you wanted to come for scaling, but you have this 5 cavity to be filled. Oh, but there is a lot of calculus can't be done by one go. Now, let's see, oh, you also have a cap issue. Oh, also you have this. Now, also you have that. Now, what does that makes me? It makes me confused. Because awareness about dentistry is less in India. So the patient is confused now. Now he doesn't know what treatment to take and what treatment to not take. He came for a scaling. Now he doesn't understand that he needs scaling or filling or what not, and what is a filling and what is a RCT I'm talking about and what is the crown I'm talking about. But I have to deliver it because I have to tell the patient what is there. Now how do I communicate this to the patient? Visual representation. Visually show the patient what is there in their mouth. Now, how do we do that? How do I show the patient? With mouth mirror, too small. With mirrors like this, very small. So, what will I do? Let's see. So, invest in good intraoral cameras. This will change your patient experience into your clinic. Now, how do we do that? Now, let's say we were talking about you have this calculus, that calculus, right? This is the Waldent Ergo intraoral camera, right? It has these 4 buttons. Let's see how to operate it. We will on it and put it in the patient's mouth. Now, this is some images that I've already taken. Let's go back and take some more. Now, the camera is on, right? Let's shift it to a bigger size. Now, I'm telling the patient, while moving the camera, the patient is able to see every finding that they have, right? See, look at all the calculus that is present in your mouth. Now, while you're moving, patient says, hey doctor, what is this? Or this is a cavity that needs to be filled. Now, let's move the camera. Now, what will we say? See all this plug. Now, for recording it, for telling the patient nicely, you just click a picture and show the patient. See, this is all the area where the debris is. Let's imagine it because obviously this is a typo, not a patient mouth. So, we will say like, see, this is the area. Now, how easy it is for me to tell the patient? Obviously, very easy because the patient can now visualize it. The patient can see it by their own eye. So, my way of telling, my way of explaining to the patient has become half. My efforts have become half and understanding for the patient has become much more. Right? Do you agree? Now, one more thing that we are going to do is, we will go back and take 2-3 photos for the patient. Right? Let's make it 4 photos for the patient. So, first photo of there, let's say calculus, then let's move to the debris, and then let's move to the cavity, and then let's move to the, let's imagine this tooth has a furcation involvement, right? So, the furcation involvement. Now, While I'm explaining the patient can see all the oral findings that the patient has. What does this do for me as a dentist? I have the patient trust. I've just gained the patient trust. Now, when I'm showing the patient thinks that I'm not making a fool out of them. I'm not giving them a treatment that is not necessary to the patient. I am telling the patient that everything that I am giving you or suggesting you is there in your mouth. Right? So now the patient understands that the treatment they have come for is a necessity. It is not something fancy that we are offering. It is not something unnecessary that we are offering to the patient. We are offering a genuine and needful treatment to the patient. Doctor, this will change the way you interact with your patient. Don't you think this was very easy to interact with? This screen has done something for me which I would have spent hours to do with the patient. The patient would have not understood what is this white patch. They wouldn't have seen it from a smaller, a smaller, I can say, mouth mirror, right? Or a normal mirror that we will give to the patient. But this is clear out there. Also, what does it do? When I will clean this all and I'll treat this all area, I can re-show the patient. So, when the patient is moving out, what will they think? Their money is not wasted. The amount of energy, the money, the treatment has been done nicely. Now, the patient trust that we gained on the first part still remains with the patient. One more thing, please make sure while you're interacting with the patient and you have seen the finding, if there is a lot of calculus present here and when you remove the calculus, there will be a gap. Inform the patient beforehand. Give them the prognosis. Prognosis is important because you do not want the patient to lose the trust on you that you have created. So how do we do that? We tell, see all this area. Let's imagine there's a lot of calculus. We will say that in the first picture, you see all this white part. When it will go after scaling, we will clean it with the scaler, right? So when it will be gone, यहाँ पे gap रह जाएगा. Always explain the patient in their regional language, a language that they understand. Never fantasize it. Never make it too fancy for the patient. Oh no, this is calculus and this is debris. Maybe the patient does not understand calculus and debris. When somebody is not understanding the language you're talking in, it is very hard for them to understand what is being done. Right? So try to be as normally interacting with the patient. If you are in any local language that the patient understands, interact in that. The patient understands English, interact in that. The patient understands any other language, interact in that language. So you are deliberately telling the patient, interaction is clear. Conversation is clear to the patient. Do you understand what I'm trying to tell, doc? I am trying to tell the trust that we have made with the patient has to be there till the end the patient walks out of your clinic after the treatment. Even if they don't get the treatment done, they still should have this trust built in themselves that this is a good dentist and he has told me everything about the treatment. She has told me everything about the treatment. And when I have to get it done, I will come to them. Right? So this is what oral examination and patient interaction I have for you. Invest in good cameras, invest in good screen. Why I have selected this one today? This is the Waldent Ergo model. If you see, it is very easily attachable to the night chair, right? Picture taking is very clear pictures. Also, it has a memory card. If you see here, it has a memory card. What does this memory card does for me? This all pictures will be saved. So if I have to go back and show the patient what was the first condition, I'll just press this button and the image will start flowing in. Right? So I can show the before and after images to the patient very easily. Ergo model from Waldent. Why I'm telling you this? Because on the fifth part, we'll discuss it. Right? What are new in the market, what we need to upgrade in the dental market or our dental clinics. Right? So patient interaction and oral examination has been done. Now patient understands what they need, what they have to get done. Now let's move to precautions and procedure. Now in precautions and procedure, what will we talk about? We will talk about what to select when we are selecting a scaler. What points should we make sure while we are selecting a scaler for our clinic? right? Now I have already interacted with a lot of doctors and I have talked to them that what are the major issues that they face while they are doing the scaling from their scaler. But for precautions, let's go by the book. So starting precautions and procedure for you. Precautions for intraoral cameras, there is no such precaution, only one is there, that is use sterilizing sleeve or use a sleeve that can be removed from the intraoral camera, right? When we are talking about our scaler, what is some precautions that you have to keep in mind while you are doing a ultrasonic cleaning? In cardiac pacemaker patients, do not use ultrasonic scalers. It is contraindicated. It is contraindicated to use in the patient who has had a pacemaker, right? Second, in children who are having budding stage, somewhere a high level of scaling will do damage, may do damage to the patient's growing bud. Third, respiratory issue patients. If the patient is suffering from any kind of respiratory diseases, make sure you're doing it on a very less and a prescription from their physician, right? Now let's move to the other part. Precautions done. Now let's move to our, also one more precaution that I want to give you is communicable diseases. If the patient is suffering from some communicable disease, try to avoid the intraoral scaler, go for a hand scaling. Now let's see in procedure. That is the main important part for us, right? Procedure. What do we have to make sure when we are selecting a scaler? What ease will we get from selecting the right scaler for us in our procedure? First of all, let's go by the book. Unit selection. What kind of unit are you selecting for your scaling? Why? Why? Power control should be there in that unit. It should have easy power control. So the scaling is rightly done and there is less sensitivity after the scaling. Remember, less sensitivity after the scaling, less tissue damage after the scaling. If you can control the power, this is solved for you. Now, what is the second point? Your instrument selection. What kind of tip you have to select for the patient? Now, longer tips will be selected for calculus removal. Stronger and longer tips for your calculus removal. Thinner tips and longer tips will go for your concavity and furcation involvement. If there is a furcation involvement and concavity in the tooth, you will always use a thin tip and always use it on a very low intensity. Never go high in the furcation area. Never go too much high on power when you are using it on the which area? Concave area of the tooth, concavities of the tooth, right? So again, longer tip for stronger and calculus areas, longer and thin tips for your calculus and furcation involvement. Now let's talk about how to hold the scaler for a maximum of retention, right? I'm using it on a typho. While using it on a patient, please wear PPEs. Yes, this is another point that I want to discuss. Infection control. While you're doing ultrasonic scaling, make sure that there is proper PPE for you as a doctor, for the patient, because there is aerosol generation in ultrasonic scaling. So do make sure that proper PPE is used, right? Now let's talk about patient's chair position and patient headrest position. So for chair position, patient has to be in a supine position, right? And for the headrest position, I will tell you this here. For the headrest position, always tilt the patient's mouth so a water pool is created in the patient's mouth. Why are we creating a water pool in the patient's mouth? We are creating the water pool to reduce the aerosol generation. When there is a water pool created, aerosol generation is comparatively less in the patient. So less chances of infection is there. right? Now let's move to strokes and stroke patterns and stroke. How much stroke we have to give, right? What do I mean by how much stroke? I mean that there should be a controlled amount of pressure that we are putting, right? So let's see that. I'm taking this dummy. How much pressure? Do I have to do it like? No, never do it like this. You will damage a lot of tissue. Always go in a lighter motion. Always go in a lighter motion. I hope you all can see it. Very light, doctors. We are not going to fight. The scaler is good. It will do its work for us. It will remove it by movement. The calculus will be removed by the movement. The tip will do its work. Never go like, okay, we'll do it. Oh, it is too much calculus. We'll just do it. Never do it. You will just damage the tissue. The calculus will come out how it has to come out, by a technique, not a jaldi pressure that we put, right? So no fast going, no damaging the tissue. Always go lighter on the turds and always create a pattern. What pattern am I talking about? How do we have to do it? Do we have to keep doing it like this? If I show you here, or I have to keep it like this, or I have to go like this? I always have to use my scaler in a sweeping motion. Always use it like a sweeping motion. Always use it like a erasing motion. Never be stuck at one point. Like, what will this do? This will not remove my calculus. This will not remove my stain. It will only remove my tissues. It will damage the tissue of the patient. So never ever try to do that. Lighter strokes, remember, sweeping motion, erasing motion. Okay, so that part we are done with procedure and your precautions. Now let's move to, what were there? Come on, in the comment section. Management and complications. Complications and their management, right? What are we discussing in complication and management? Now what can be the complications in scaling, right? There can be uncontrolled bleeding. Why uncontrolled bleeding would be there? Might be the patient is on thinners. So always take a brief medical history of the patient to avoid any kind of complication. When you have established the trust, when you are doing the oral examination, ask the patient, because in India, 90% of the time, patient does not even know what is the problem. They might tell you that there have been a lot of ulcers in my mouth recently. Some point they will give you which will make you understand the insight of the patient, which is not on the prescription of the patient, but you will still understand about it, right? So take a brief medical history. Now, apart from taking a brief medical history, if any code blue situation happens, doctors always know a code blue situation can happen in any patient, healthier patient of yours, healthiest patient of yours who has no medical history. Code blue can still happen. Still happen, as small as syncope, as small as any kind of issues can happen to the patient. So what do? Always make your staff and yourself aware about and updated about BSL training. Basic life support trainings. So keep rejuvenating and keeping a session in your clinic is very important. Train your staff, train yourself, train everybody for a code blue situation in your clinic, because it can happen anyone and everywhere. One more tip for you, which is very important, again note it down, guys. What? Always have the ambulance number in your clinic. Always have an ambulance number in your clinic, and all your staff should know that number by heart. If not, as much as we can, because any patient can be your code blue patient. Don't think this is a young patient, very healthy patient, nothing will happen. It can happen, right? We have all seen it, we have all been there. So always be prepared for a code blue situation, right? Now let's move to complications. We have done, management we have done, right? We have had the number, we have done everything. When the thing happens, we are all ready for it. Now let's move to our final part and the fifth part. Doctors, all above, हमें क्या करना है, अपने आप को अपग्रेडेड रखना है. वी हैव टू अपग्रेड ourselves. Dentistry needs upgradation in India. What do we do? How do we know that what lettuce in the market is there? What is there that we have to upgrade to ease ourselves and give a proper treatment to the patient in less timing? Less timing, accurate treatment, and treatment that eases us as well. Give us a precise way of working as well. What can be done? Now, if I talk today about scaling, two important things that I need to have in my clinic is a intraoral camera, that is intraoral camera, which I have had today with me. Why I selected this, I will give you all the reasons. First of all, look at the camera. Very nice quality it has, right? Extremely nice quality. Look at the picture quality. It has the memory card. I can show my patient my before and after, right? This is the Waldent Ergo model with screen. It comes with this screen, so inbuilt, very easy to use, right? You can install it in your chair. You can also have it on a stand in your clinic, right? So 4 features that it has. The camera quality is nice. You can capture 4 pictures at a time. You can go back and show your patient, what are you talking about, right? What is the treatment you're talking about? What is the treatment that you have given to the patient? So first is your intraoral camera. I have used the Waldent Intraoral Ergo model, which comes with the screen as well, right? So for me, giving a quality treatment to my patient is one of the most essential things. Why? It differentiates me. It tells my patient how important they are for me. How much energy do I spend on my patient? How am I collectively selecting something best for them? What are my intentions to my patient, right? These kind of cameras come in a lot of variety. Download the Dentalkart app. If you are a dentist and you're working in India, Dentalkart app is one of the apps that should be in your mobile. Why? Latest technology is there. All the technology that is coming to India, we make sure that is on the app. So what will it do? It will make you aware. Even if you're not buying it today, you will be aware what is coming new. What is there? What is there that I can keep on my checklist for my patient? So always have the Dentalkart app, right? Second, let's talk about the scaler. Remember, unit selection is extremely important from procedure. Extremely important, doctors, right? So let's talk about the scaler that I have got today. This is the Ultrawave Max Piezo 4. Comes in 3 different modes. Very easy, touch accessible. Comes with a inbuilt irrigation system, which has antibacterial property. Now, the main problem was infection control, right? Infection control is one of the biggest problem in aerosol generating procedures. So, bacterial growth stop is something very important for me. The scaler is doing. I have a one-touch access. So, extremely easy for me to control my power. Again, we are going back to our unit selection. Power control is important, doctors. Why? How much you do the scaling right. If it is on a high power, later on it is going to cause a lot of sensitivity to my patient. I don't want that. I have just gained my patient trust. I have done so much to gain the patient's trust, to make the patient my patient. I don't want them going back home and then coming next day with all of the sensitivity, right? Modes are easy. Also, it does your endodontic work. So, irrigation work is easy. Irrigation is easy for me. I just have to change the tip. The tip comes in this unit as well, so I don't have to buy the tip as well, right? What I have done by investing into this, I've invested in the peace of my mind. I have invested in a good quality product for my patient comfort. My patient has the comfort. I have the control. My patient has the comfort. What's more that I knew, right? So, Waldent camera model, Ergo model comes with the screen. You can also go on the Dentalkart app, explore a lot of other options. Which scaler did I use? Waldent Ultrawave Max Piezo 4. Buy this, already told you. If you want to know more features about this, go onto our app, right? Or you can visit the Dentalkart YouTube channel after the live is over, and there is a dedicated video about this one. You can go ahead and check it too. Any kind of recommendation that you have for us, write it down in the comment section. We will love to explore. Tell all the dentists who are present there what are the good things in the market, what is the updated thing in the market. Always come to workshops like this, attend a lot of workshops. Keep yourself updated. Keep yourself on point to make the patient comfort first thing for you in the clinic, and also your comfort, your level of ease when you're working. It is important, doctors. If you are peaceful, if you can work nicely, you will deliver better, right? So that was all from my side. 5 topics we have covered today. I hope you would have learned, have some takeaways from us from today. Do comment in the comment section. How did you feel? What did you think that we missed? If you think anything that we need to cover in our next session, please write it down. Anything good you have learned from us today, write it down. It is really important. So for the next time when we come, we are well prepared for your answers as well. Right? We will come, we will try to capture that questions, and we will try to capture your answers. Right? Now let's move. I know you all have been waiting for the questions because you are still at the winning point, right? So let's give you all guys 3 questions. Ready? 3, 2, 1, questions, right? The first question from the workshop is, what is the 3 listening tool that I gave you today? What is that 3 points in a listening tool that I gave you today? This is your first question. Second question is, what was our aim when we were trying to master the psychology of the patient? What was our aim from the first topic that we selected, mastering the psychology of the patient? What was our aim from that, right? Now let's move to the third question. For the third question we have, which is the intraoral camera that I have used today? Go ahead, I've told you the model a lot of times, so you must have known now. Or if you want, you can just do a little bit of cheating on Dentalkart app. So what is the model of intraoral camera that I've used from Waldent today on this workshop? I'll repeat the questions again for you all, right? Number 1, what is the 3 listening tools that we have learned? Second, what is the aim when we try to master the psychology of the patient? We wanted to dive in the psychology of the patient. And number 3, which is the intraoral camera that I used today on this session? Come on, doctors, I'm giving you 1 minute. Answer, comment down below your answers. Also, please mention your email address with your answer so we can reach out for you if you're one of the lucky winner, right? So kindly mention your comment down below the answers and also mention your email address. If you have not done it, write it on the next comment section, right? And time's up, bol do? Abhi nahi. Okay, let's go. I'm giving you 1 full minute for it. Come on, doctors, give me the answers. Come on, come on, come on. Let's see who is going to win. I'm really excited for all of you, and thank you. I want to thank you from the bottom of my heart. Thank you for joining us today. Thank you for listening to me. Thank you for coming and learning something. I hope you guys have a community and you have been connected on Instagram to us. If not, please connect to our YouTube, please connect to our Instagram. We try to give you every latest information in dentistry on our YouTube channel, on our Instagram channel. So be connected. Let's make a good dental community for all of us where we can meet each other and thrive. Also, do download the Dentalkart app so you get every product at a discounted rate, and also be updated about the dentistry, right? Be updated about what's new in the market, what are we exploring, how can we make our practice better. We will keep doing these workshops and we will keep taking topics from all of you, and we have also written a form for you after the workshop. We will add the form as well. Kindly try to fill the form for the next session so we can understand what you want to learn from us. Thank you everyone. Thank you for joining us. I am very thankful, and see you all next time. Do subscribe and be connected.